GP Dr George Crisp has been reviewing the links between health and the environment for over a decade.
Coal mining has a variety of health effects, both in communities where coal is mined, but also as a consequence of combustion of coal, mostly through air pollution from burning coal.
While the health effects of coal and gas have been poorly researched in Australia, they've been well documented overseas. Associate Professor Ruth Colagiuri recently reviewed the literature on coal mining and combustion.
The most concerning impact is the excess deaths associated with coal mining for residents, local residents, and that includes death from lung cancer, from kidney disease and from heart disease.
The major effects in coal mining communities relate to respiratory diseases and heart disease. There are also increased rates of high blood pressure and renal disease. In children particularly, there are greater rates of wheezing in coal mining communities, and there is evidence for low birth weight children and fetal abnormalities in those communities.
The international evidence on coal-fired power shows different health effects to those of coal mining. The source of coal and the pollution controls at the power station also affect health outcomes. Some of this literature relates to a few studies in Europe and China, so it may be site-specific.
Again, there were excess deaths, but they're from different causes. So there are deaths from laryngeal and bladder cancer in terms of diseases and illnesses, excess skin cancers, and that's thought possibly to be due to the pollutants and some of the arsenic that can be associated with coal-fired power stations. The effects in children are a little bit different, and again, always the respiratory disease, but there are also some quite alarming findings like excess stillbirths, miscarriages, DNA damage, and something that could lead to cancer in later life.
How serious is the impact of air pollution on health, and what does it tell us about the health risks associated with coal?
We know quite a lot about air pollution and how it affects human health, particularly cardiac and respiratory disease, and we know that coal mining and burning results in significant quantities of air pollutants, particularly gaseous compounds like sulphur dioxide and nitrous oxides, and also particulate matter.
NOx and SOx are very irritating to the lungs, so can exacerbate asthma, bring on coughs, make people feel pretty unwell.
As a public health physician, Associate Professor Linda Selvey has a long-standing interest in the health effects of coal and climate change.
Well, the toxins can attach to the particulates, and when they're very small, that means they can get into the bloodstream and get carried to different organs in the body. The heart seems to be one of the most susceptible.
We know that the very small particles that are emitted through particularly fossil fuel combustion deliver some of the toxic components that they carry, like hydrocarbons and heavy metals, deep into our lungs. We estimate that more people die from air pollution in Australia than Australia's road toll. The Australian Bureau of Statistics estimates that at least 2.1 or 2.2% of Australians actually die as a consequence of air pollution.
What about the health risks to people who work in the industry? From an occupational health perspective, even in a country like Australia, which has really good occupational health and safety standards, mining, and particularly coal mining, is still one of the largest causes of occupational injury and death.
Mercury is another pollutant produced by coal-fired power. Mercury from coal pollution enters the food chain via oceans and waterways. It's been found near coal-fired power stations in Australia, but despite this, the links are yet to be investigated.
Well, for a number of years, mercury has been detected in both fish and sediment taken from some of the rivers in the Latrobe Valley, the Latrobe River and a number of other rivers and streams. Now, mercury doesn't happen naturally in that area. It has to have arrived there through some sort of pollution.
Recently in Collie, a study demonstrated that there was mercury in the sediments in the local river system, and this requires further attention because we know that mercury, even at low levels in human populations, results in damage, particularly to fetuses and children.
Coal and gas are major sources of greenhouse gas emissions. Our coal-fired electricity makes Australia one of the highest per capita emitters of carbon in the world. A study in the American Economic Review found that the health costs of coal in America are greater than the value of the industry to the US economy. So what are the health costs here in Australia?
Well, there's very little evidence about the health cost of the coal industry in Australia, except for one report which indicates that the health costs alone from generating coal-fired energy is $2.6 billion per year.
83% of the Australian mining industry is foreign-owned, so much of the income generated here is transferred offshore. The federal government annually spends $10 billion on subsidies to the coal, gas and petroleum industries.